According to the National Institute of Mental Health, 1 in 5 Americans live with at least one mental illness. With so many people dealing with this mental health crisis, it is extremely unbelievable to me that so many people lack awareness and understanding for these issues. Personally, I think that talking about mental health is essential to making sure that there is a more open and inclusive environment in the world for people who struggle with mental illness. I have myself had my own mental health struggles throughout the years, and I believe that it's super important that everybody is educated in the general population about these issues, not just the people that feel the effects in their everyday life. I'm going to be covering different topics of mental disorders and how they affect people's lives and the symptoms and treatments for them. I'm going to cover 3 categories of mental disorders, the first of which being anxiety disorders. So, how many of you have struggled with anxiety or know someone who has struggled with anxiety? It's a very common problem and it affects millions of people, and there's a very high probability that you yourself have experienced anxiety throughout your life. So, first disorder I'm going to be covering is panic disorder. And panic disorder is the most severe of the anxiety disorders. It involves frequent and severe panic attacks that can last for long periods of time, and those involve racing heart, chest pains, unexplained random pains, shaking, sweating, and just feelings of immediate danger. This can translate into people's lives very negatively because it can make it very difficult to do everyday tasks, to eat, to take care of yourself, to go to work, to form relationships and keep up with them. And so treatments for this include talk therapy, cognitive behavioral therapy, and even medications like SSRIs, like Paxil and Prozac, just for 2 examples. And in some extreme cases, benzodiazepines like Xanax and Klonopin can be very helpful, but they are very habit-forming, so it's difficult to be on them for a long time. The next disorder is general anxiety disorder, and this can take a really big toll on people because it involves prolonged anxiety throughout long periods of time. It can cause irritability, it can cause problems sleeping, it can cause problems concentrating, and just lots of things, and just general feelings of uneasiness and being overwhelmed. And this can translate into life because since they can last for, anxiety periods can last for months, days, whatever, it can be very difficult to continue on with work and school and go out and socialize and do things that you normally would because you feel very overwhelmed. And treatment for this includes talk therapy, cognitive behavioral therapy, and then anti-anxiety medications, SSRIs, and even antidepressants at times can be helpful. Next is obsessive compulsive disorder, or otherwise known as OCD. A lot of people think that OCD is just being a quote-unquote neat freak, but that is not the case. Most of the symptoms include intrusive thoughts that something really bad will happen to you or a loved one. It can cause a feeling of lacking control in your life. It can cause ritualistic behavior in order to try to stop the intrusive thoughts from happening or to regain control back into your life. This all adds up to being very negative on someone's life who has it. It can make it so difficult to go do everyday things. It can make it hard to be punctual and meet up with obligations and just do things that normally people would think would be easy, like socializing, working, school, etc. And treatment for this, there are medications that can be effective in certain cases, but for the most part, talk therapy and especially cognitive behavioral therapy have been the most effective. Cognitive behavioral therapy can help create good boundaries and create mechanisms that will help you stop these behaviors and problematic thoughts in their tracks. And these are just a few of the anxiety disorders that do exist. There are many more, and you can have multiple in combination. And I'm going to move into speaking about mood disorders. So, how many of you have seen a portrayal of depression or another mood disorder in the media, whether it be movies, TVs, etc.? They're usually very stigmatized and often very negative or one-track-minded portrayals of what mood disorder would look like. For example, how they would act outwardly, how they would look, how they would dress if you had a mood disorder. But that's often not the case, and usually it is not openly evident that somebody would have a mood disorder. So, first of which I'm going to talk about is bipolar disorder. There are 2 types of bipolar disorder, but I'm just going to talk about general symptoms of both. This is characterized by very high highs and very low lows. The highs are periods of mania, which includes having a lot of energy, having extreme mood changes, making sporadic decisions out of nowhere. And then periods of depression are the lows, and this would include being withdrawn from friends and loved ones and just feeling overall sense of hopelessness. And this can affect people's lives because it makes it very hard to maintain any types of habits, eating healthy, exercising, keeping a job, keeping up with friendships. It can be very, very difficult and taxing to try to manage that while also managing the internal ebb and flow of the mania and depression. And so treatment for this includes talk therapy, cognitive behavioral therapy, and there are also medications, SSRIs, antipsychotics, antidepressants that can be very, very beneficial for people living with bipolar disorder. The next disorder is major depressive disorder, and this comes with feelings of prolonged depression, sadness, and hopelessness with really no clear cause and no end in sight to the people who have major depressive disorder. It can be very difficult. They become irritable and just lethargic and really just not wanting to do much because it feels very hopeless. And this can translate into life because clearly you don't want to leave the house. Some cases, severe, you can have suicidal thoughts, you might become a danger to yourself, and it can just be very, very difficult to manage life like this. And so treatment for this includes talk therapy, and antidepressants, SSRIs. Some of the most common medications for major depressive disorder include Zoloft and Lexapro, which are two very common antidepressants, and that can be very beneficial for people at times. Finally, seasonal affective disorder is the last mood disorder I'll be covering, and this can also be known as seasonal depression. A lot of people experience this. It is sadness and extreme depression during the fall and winter months when it's colder, and same symptoms as major depressive disorder, just during different times of the year, not all the time. And the treatment of this is usually talk therapy, and sometimes people can be prescribed antidepressants or SSRIs to help them during the periods of time that they are feeling this seasonal affective disorder. But it's important to remember that there are also different subsets of each mood disorder. Everybody displays their disorders differently. It's not going to be outwardly visible to everyone if someone has a mood disorder. And finally, I'm going to be speaking about eating disorders. So this is a very sensitive topic, so if you feel comfortable, raise your hand or nod along if you or someone you know has ever experienced body image issues with the way that they look. I know that in this day and age of social media and comparison to others and social media and just standards that are set by that, it can be very, very difficult to be comfortable within yourself, and it can be very easy to develop body image issues, which can in turn lead to an eating disorder. So I'm going to be covering 3 eating disorders, and the first of which is anorexia. So anorexia is, the symptoms of it are mostly body dysmorphia, where you feel that you look a different way than you actually look, and a restrictive eating, where you will eat very, very little calories daily, and sometimes it can include excessive exercise to compensate for the things that you eat, even though you're already not eating very much. And this can affect people's lives because not only do they have low self-esteem, they can have a lack of energy from a loss of nutrients. And so it's difficult to do things in everyday life, to have the energy to go out of the house, to socialize, to do anything besides think about food and exercise. And this can also ultimately lead to hair loss and other health problems like organ damage because you're not getting the fuel that you need for your body to survive. And treatment for this includes inpatient treatments. Sometimes if it has to do with depression, antidepressants can help, or talk therapy and cognitive behavioral therapy. Next is bulimia, and bulimia is not as common as anorexia, but it's also very common, and it involves binging and purging. So you would eat a lot of food and then you would vomit it back up in order to avoid getting those calories to intake into your body, and also just to avoid guilt or feeling of being too full. And so this can affect people's lives because it can cause tooth decay, enamel decay, acid reflux, dehydration, and just overall health problems. And then, of course, because you're not getting the nutrients that you need, can make people severely underweight. Treatment for this is the same as treatment for anorexia. Inpatient treatment and different types of therapies can be very beneficial. And then finally, binge eating disorder is the last one I'm going to be speaking about. This is very common in adults, especially in the United States, and it's where people feel a lack of control and they just eat large amounts of food in small periods of time. And it can be very easy for it to get out of control, and then they feel feelings of guilt and shame afterwards. And this translates into life because you can gain weight, obviously, from eating lots of food like that. You can feel very uncomfortable and overly full all the time. You can feel feelings of shame or embarrassment when it comes to not being able to control yourself. And it can just take a lot of mental toll on people. And treatment for this includes talk therapy and cognitive behavioral therapy, and it's very important for people to kind of get to the root of these issues and build healthier habits and healthier thought process around eating. Eating disorders go beyond just a mental health issue. It becomes a very important physical health issue after a long time because you're not giving your body the right nutrients or enough nutrients or whatever it may be. Overall, there are unique effects and symptoms for every single mental illness, and I've just gone over 9 of the hundreds of mental illness and disorders that exist. It is important through all this to remember that mental illness is not always recognizable or outwardly seen by people around, so you need to treat everyone with kindness and respect and understanding because you don't know what they're going through and struggling with in their lives inside their head. And I just think that talking about mental illness will make it way easier for people with mental illnesses to get the help and support that they need in order to succeed and to thrive and to recover as best as they can from these issues that are difficult for them. And overall, I think that is very, very important to be aware of the signs of mental health issues, to look out for your friends, to make sure you check in on your loved ones, and to take care of your own mental health as best as you can. Thank you.